What questions do you ask your doctor? What questions do you ask your doctor? Now, I want to talk about this topic today because when I was a home health visiting nurse here in the Houston area for 18 years, I ran into a lot of people who were afraid to ask their doctor questions. So we would talk about what questions they wanted to know from their doctors, and we would recommend that they would write them down on a piece of paper. And whenever you got to the doctor's office, then you would hand him or her the paper that you had your questions on. And even asking questions with a piece of paper, they felt intimidated. But I want you to know that it is very important to ask your doctor questions about your disease process, about your diagnosis, so that you can be informed. Now, I have today 7 questions that I actually recommend that people who got a diagnosis of diabetes, I recommend that you ask your doctor these particular questions. Now, these questions are important because it's going to help you to understand the disease process and the diagnosis of diabetes. So it's going to help you with either type 2 diabetes or pre-diabetes, because those are the most common diagnoses. Okay? And it's very important to stay informed. So if you don't ask your doctor these particular questions, I do recommend that you do a Google search about it, or buy some books about it. So when you get a diagnosis of diabetes, you have to educate yourself about it. You can't just not think about it and think it would go away, because it's not. And the more things that you know about diabetes, the more understanding you have of the diagnosis, then the better equipped you will be to overcome it and to manage it and to reverse it. Okay, for those who want to reverse it, because there are many people out there that want to reverse it. Okay, so the first question is, what type of diabetes do I have? Now, you might want to get your pen and paper and write some of these questions down if you've never asked your doctor these questions. Okay, so number 1, what type of diabetes do I have? And you want to know that. You want to know if you got type 1, type 2, or even gestational. So gestational diabetes is when you're a woman and you're pregnant and you get diabetes during your pregnancy. That's called gestational diabetes. And actually it goes away in most cases. It goes away after the pregnancy is over, the baby is delivered. Number 2, what is my A1C level and what does it mean? Okay, so what is my A1C level and what does it mean? You want to ask your doctor that. Now, A1C is a measure of the average blood sugar levels, okay? But you want your doctor to let you know. Now, it's going to be a lab test that he's going to order for you, and you want to know what your A1C level is, okay? You should know that at all times, okay? Now, number 3, what are the potential long-term effects of diabetes? Okay, what are the potential long-term effects of diabetes? This is a question you want to ask your doctor. Okay, so you also want to know that in most cases, some of the long-term effects of diabetes is heart disease, kidney disease, nerve damage. So those are some, but you want to ask your doctor this question. Okay, so utilize your doctor for the information, okay? Now, number 4. What are the warning signs and symptoms of diabetes? Now, we're not going to go into that today, but on another video that we did, we talked about the 4 P's of diabetes, polyuria, polyphagia, polyneuropathy, polydipsia. Okay, so these are 4 P's of diabetes. So some of those are the symptoms that you may have. Now, number 5, what's the difference, I'll say? What's the difference between pre-diabetes and diabetes? What's the difference? That's what you want to ask your doctor. Okay? Number 6, how do I know if I'm at risk for developing diabetes? Now, maybe you don't have diabetes already. Maybe your family members have diabetes, great-grandparents or uncles and aunts and people like that. They may have diabetes, but you want to know what your risk is for getting diabetes. And your doctor would be able to answer those questions, that particular question. And any of these questions that I've stated so far, your doctor would be able to answer them for you. And I do recommend that you ask your doctor these questions, okay? And then the last question to ask your doctor when you get a diagnosis of diabetes, the last question I want to recommend that you ask your doctor is, what test do I need to confirm my diagnosis? Okay? So these 7 questions are questions that I recommend that when you go to your doctor, ask him these questions, especially if you think you might be at risk for getting diabetes, or you've already newly just got a diagnosis for diabetes and you don't know what is going on. Don't hesitate to ask him these questions. Or if you are afraid to ask him, ask Google, because you need to be informed about the disease process, what to expect, what not to expect. So there is a lot for you to understand related to the diagnosis of diabetes. Okay? So don't put your head under a rock. Go and be checked. If you've never gotten a test to see if you have type 2 or pre-diabetes, I do recommend that you do that, because too many people walk around with a diagnosis of diabetes and have no clue that they have it until it's too late. And something happened, they end up in the emergency room in a coma. Okay, so it's not, if you know your family has diabetes, if you know people in your family has diabetes, go get checked. Don't avoid it. Don't think it's not going to ever happen to you. Just be sure. Okay? So that's my message for today. So we will talk to you again tomorrow.